Welcome everybody, hoping everybody can hear us. Welcome and thanks for joining us at our infection control webinar. I'm Jan Sadler, I'm the Practice Support and Development Team Leader for the Central and Eastern Sydney Primary Health Network. I would like to start by acknowledging the traditional custodians and sovereign peoples of the land across which we work. We recognise their continuing connection to land, water and community and pay respect to elders past, present and emerging. We also extend that respect to any Aboriginal colleagues who may be joining us today. So welcome everybody and thanks for joining us for our webinar. This is a whole new world that we're doing our education now. I'm sure everyone will agree that it has been a very busy and interesting time the last few months since COVID-19 became a large part of our lives. For all you out there at the forefront of all of this, you are truly amazing. We at CESPN have spoken with a lot of you over the last few weeks and applaud you for all your efforts. There is a lot of information out there on COVID-19 and we are keeping up with this every day. Our website is a great source of information, so I'm going to quickly just show you where everything is, and then we will get to the most important part of the night, which is our presentation on infection control, which you will agree is paramount at this time and always, of course. So I'm just going to go over to our website. So our website, as you can see, is here. We have a dedicated coronavirus page. Our website is cespn.org.au. And as you can see, if you go down the page, there's a contents. There's also the last updated date and time on anything around coronavirus. So, and you can see this at the top of the page there. So you know that's always been kept up to date. Some of our days have been daily updates, hourly updates and minutes, and it's just been pretty frantic, as you would know, over the last few weeks. So if we go down the contents, you can see the type of information that we have on our website. We have the current situation that's happening, and you can see here that you have the New South Wales web page, the latest advice and testing advice. So please keep up to date with all this. You have masks. Now we know that masks are very important at the moment and everybody's been talking about masks and PPE. If you go to this part of the website, you'll be able to see that there's a mask request form. So please, if you need to order masks and you are out of masks, please use this request form. I won't go through all the contents, but some of the important ones at the moment is testing. So if you go to the testing part of our website, you can see that there's information on testing, criteria, the testing centres, you have the pathology clinics that are available, and you also have the screening clinics that are coming up all the time. So a new one today was the St Vincent's Bondi pop-up clinic in the Bondi Pavilion. So and there's new ones starting up very soon, so please keep an eye on that also. You'll see that there's resources for general practice, and under the resources for general practice, you'll see that there's information around pandemics and planning, and there's a toolkit that you can fill in from the RACGP. So we should hope that all practices fill in a toolkit from the RACGP for being prepared for a pandemic. There's also information on health pathways, so the Sydney Local Health District and the South Eastern Sydney Local Health District health pathways are now available around COVID-19. There's also lots of posters for display in your practice, and there's education videos and webinars, and this is being added to all the time. So keep an eye on those because we'll be adding webinars and all different videos from other places also, from other providers. And this one tonight will also be up on our website. There's information further down around useful links. So you'll have lots of links to really important places that have information around COVID-19. And also, most importantly, the public health unit numbers are also here if you are not sure about those. There's also some information now on there around business support for doctors and allied health professionals. So, and we all understand it's a very trying time at the moment. So that's our website. So please keep an eye on the website, and it's a really good source of information. It's being updated regularly, and if you need to have any information on coronavirus, if you need information, you can give us a call at the PHN, and we're on call all the time for your answers. A bit of housekeeping for tonight will be, please submit your questions by typing them in the questions tab of your screen. Questions will be answered at the end of the presentation. Please, we'll try and stick to the questions around infection control tonight. If you have any other type of questions around coronavirus, please let us know. You can email us at the PHN. We have a coronavirus email address, coronavirus@cespan.com.au. So if you have any other type of questions, please email us or call us there. But tonight, let's stick to the infection control questions. Fleur Niven is one of our practice support officers, and she's going to help us facilitate the questions with Karen. If we run out of time for all the questions, because we have a lot of people online tonight, and thank you all for checking in on us, we'll put a question and answer sheet together after this tonight, and we'll send it out to everybody after the webinar. If you have any difficulty with the audio or video, please check your settings and connection. At the end of the session, you'll receive a link via email to the online evaluation form. Once you've completed this, you will receive a certificate of attendance. So now I think we should get on with the presentation. So I'm going to introduce Karen, Karen Booth is the President of Australian Practice Nurse Association, APNA. Karen is a registered nurse presenting tonight on infection prevention and control. Karen has worked as an RN and a practice manager since 1998. Her areas of expertise include preventative health, immunisation, infection control, diabetes, chronic disease care and coordination, data management and accreditation. Karen has set up systems in general practices, including nurse-led clinics supporting a team care approach. Karen has a keen interest in workforce development and advocating for the role of the nurse in primary health care. Karen holds a number of advisory positions for health, including the National 10-Year Primary Health Plan, the TGA, MBS Review, RACGP, and a few others. Karen is also a member of APNA, AAPM, Australian College of Infection and Prevention and Control, and AICD. Please welcome Karen, who will speak on infection prevention control. And take it away, Karen. Thank you.
Great. Thanks, everyone. Hi. I just wanted to say to you tonight before we start that this presentation is going to be pitched to the broad audience. It's not going to be overly scientific, and so I hope that there'll be information in here for you and for your team. So not just for doctors, not just for nurses, but also very importantly, those people that help the whole practice tick over, the administration team. The type of things we'll be looking at through our learning objectives is we'll do a cover up on the basic or what the things I think you really need to know about infection prevention control in the general practice setting. We'll look at how you can protect yourself from possible infection, because if you know how to do that, then you'll know how to protect patients. We'll talk a little bit about managing waiting room, but we're going to kick off with some points about clinical governance, which I think will be important, in particular, making sure that your policies are together. And we'll look at the College of GP pandemic flu kit. I was on the team that was originally advised on the flu kit, and whilst it's probably needs some updating, I think it's easy to follow, it's accessible for you, and it's got exercises in it to help set up systems within your practice. And of course, most importantly, infection control is everybody's business. So we'll kick off with, I think, a little chat about clinical governance. So clinical governance is a system through which organisations are responsible for continuous quality improvement and safeguarding high standards of care and creating an environment in which excellence flourishes. This is from the College of GP accreditation standards, and you can see there our practice leaders have designated areas of responsibility for safety and quality improvement in practice, and our practice shares information about quality improvement and patient safety with the practice team. And that's just to reinforce that you have a whole of team approach. The Commission for Quality and Safety in Healthcare also have some very good publications around clinical governance, and making sure that you have a system in your practice for clinical responsibility and accountability so that your team know if something goes wrong, who do they report to? What's my clear reporting pathway? If I see a problem, how do I escalate this? And of course, who's in charge that can fix that problem? And relating to tonight's discussion, we'll look at clinical governance principles around understanding modes of transmission. So it's important the health clinicians will know that, but maybe not everyone in your team knows that. So we need to make sure that we cover off on that for our staff. Making sure we've got safe work practices in place so that we know that our staff are trained in infection control. And of course, that governance structure, do we have a policy in place? How do we check that the team is adhering to that policy? And what are the levels of accountability? And of course, infection control and the clinical governance for that is an occupational health and safety issue. So as employers and managers, we actually have a responsibility to the people that work for us, who we expect to perform their work, their duties on behalf of the practice. Employers have the duty of care for the safe work environment. And we need to, as part of our systems that we set up, make sure that we understand the requirements for personal protective equipment. Who has to wear what? Who wears gloves? What activities do we do? Does everyone in our practice know how to wash their hands properly and about hand hygiene? We need to make sure our team is safe against vaccine preventable diseases. And as part of accreditation, when the accreditors come, they want to actually see the vaccine records, the immunisation records for your staff, or if they have decided not to vaccinate, then do you have an objector form that staff has signed to prove that you have asked the questions around immunisation and their personal safety. And of course, everything you do, you actually need to look at staff education and competency checking. Yes, I've told them what to do, but do they really know how to do it? And before you can expect someone to be accountable, they actually really need to know what to do and have it checked that they're doing it properly. So clinical governance, how to build a system in your practice. I think your practice needs to determine the risk in their own context. Are you a practice that does sterilising? What's the age mix of the workers in your practice? Is there anyone with a chronic disease at the moment in this context that might need safeguarding? And it's vital that practices really regularly conduct infection prevention control assessments. Now, that might be as simple as a walkthrough A lot of practices can appoint an infection control coordinator. Often that will be the nurse, that will be activity handed to the nurse. Sometimes it's actually quite good to have someone who's on the admin team to go through and do an audit for you with fresh eyes on a tick list that you give them. Are my sharps containers in the right place? Do I have signs up about hand hygiene? Do my staff know what to do if they prick their finger, if there's an issue? So they all staff need to know their responsibilities in their job, but also managing risks within the practice, and in particular at this terrible time, infection control risks. It's good to have a designated responsibility, an infection control officer, and you can put that in your practice policy. And of course, at the moment, very important that you have someone in the practice to take a lead position as your pandemic coordinator, or you might have a pandemic leadership team, someone who can check on what's happening in the practice, someone who can keep up to date with the mountains of correspondence that is coming through. And of course, it's a very fluid situation at the moment. So someone who can actually keep on top of that for you and maybe guide it or give instruction during your team meetings. And really to remember that infection prevention and control is a team effort. Everyone needs to know how infections spread. And in many practices, this will form part of your practice orientation program. And of course, there are a number of flagged indicators in the accreditation standards to make sure that your team is safely trained and they know what they're doing. You should include teaching the principles of infection prevention and control, the audit we've talked about, and of course, practice meeting Q&A, ongoing education for your staff. Staff turns over and you might have a fantastic infection control session, and then 12 months later you've got 4 new team members who haven't had that, which is why it's important to include that in your staff orientation. And of course, a practice team member who can check the competency of those of the other team members. More than a buddy, someone who actually can say, teach and then assess that they're doing it correctly. And I put in here, don't forget the cleaner. And when I do my standard infection control talks, we always talk about cleaning contracts. And if you're in a big practice, you probably have a commercial cleaner. A lot of small practices will have a local cleaner, and that local cleaner might do the dentist next door, but they might have been to 3 other houses before they get to your practice and use the same equipment. So you need to have some agreement with your cleaner about equipment. It's better if you have your own equipment in the practice, so you know what's being used has only been to your practice, and of course the type of chemicals that are used in the practice. And very importantly, if you are using just a local cleaner, that they have an idea of the risk at the moment. So it's important to protect them as well. Education and training. The activities that we're expecting team members to do needs to be performed relevant to their duties. So if someone's going to do the instrument sterilising, they need to have been trained to do that. So we need to make sure that the expectations of what we want people to do, that they're trained, that they have the understanding of the activity that they're doing and how to manage the risks such as infection. All practices should have a cleaning schedule, and particularly it's in the infection control standards, also in the accreditation standards. You should have it displayed, and the staff should all know what is the cleaning schedule. what surfaces do I clean? How often do I clean them? And of course, with the current pandemic, we need to ramp that up, probably to doing bench tops a couple of times a day. And again, checking that that person is competent. I've got the picture of the biohazard kit there as well. And the PHNs usually have a list of things that need to go in the biohazard kit for you. So we'll move on just to some general information about how infection spreads. So contact transmission, just simply touching things. Someone has contaminated hands and they touch things. Come in contact with objects, the next person comes along, touches that and picks up the bug. And that happens with flu, with other viruses, and of course, children's playgrounds. That's why the children's playgrounds are all shut at the moment. You can't go to the gym because other people will touch that equipment. You might pick up the bug off the touch surfaces. Droplet infection, we're hearing a lot about droplet infection, people coughing, those big particles. They travel usually about 1 metre, and we're all being told to social distance 1.5 metres, I think is the amount being most often quoted at the moment. It sprays, people walking past can inhale it, it lands in your mouth. Your eyes also, unprotected eyes, are a source of absorption for the bugs. People touch their face. And again, all of those things there that you can see, influenza, whooping cough, lots of respiratory viruses, and of course the coronavirus. And small airborne particles. So these are smaller particles. Again, they can be coughed or a forceful sneeze. They can come from procedures such as using nebulizers. So if you have someone come into your practice that you feel may have an infectious illness, don't use a nebulizer. The high pressure air or oxygen coming through the nebulizer, yes, mists the Ventolin for them, but it also mists everything they're breathing out and comes out into the room. So preferably, if you have to use Ventolin on a patient, you're best off using spacers because it decreases that chance of the misting and the bugs flying around that you can inhale. Other forms of infection that we're not covering tonight, but just to be aware of, are things like vector transmission. So we all know malaria, Ross River fever, the plague caused by insect bites, and vehicle transmission. So things like hepatitis and cholera that come through infected water. Couple of pictures here to illustrate the coughing. You can see the lady with the amazing hairdo, how far she can spray. The little one down the bottom in the red jacket, all the kids are being taught now to cough into their elbows. And the little baby up the top, who's very young, has obviously got whooping cough from inhaling the droplets from someone walking past and coughing at them. And again, touch, all of those things we do every day. Our hands are our main tool of work. With door handles, medications, our phones, equipment, stethoscopes, blood pressure cuffs, all potential to transfer bugs to you or you to those things. And of course, your telephone in the practice. I wonder how often people think to wipe their telephones in their practice. So how do you protect yourself? What are we going to do to help keep us safe and to help keep the people around us safe? We're hearing a lot about standard precautions. You have to follow standard precautions. You think, oh, goodness me, what is that? And we need their work practices that are used consistently to achieve a basic level of infection prevention and control, and to protect health professionals, practice staff from the transmission of infection from patients to us. So they include things like hand hygiene that we're hearing a lot about, personal protective equipment, mask, gown, gloves, cough etiquette, respiratory hygiene. When we're doing dressings and surgical procedures, of course, the clinicians will use aseptic technique, so a no direct touch technique. Safe management of sharps and clinical wastes, environmental control, making sure that you have appropriate equipment and training for cleaning and spills management, waste disposal, laundry services, and of course, effective processing of reusable instruments. So I've been told to take precautions. And just to highlight the type of protection that you might be thinking about. So contact precautions, we're looking at using barriers to reduce the risk of direct or indirect contamination. And they're things like PPE appropriate to the risk. So there's no need to put the full kit on if you're going into someone who isn't coughing. So droplet precautions, of course, you need to wear a mask. So if someone is coughing, there's a risk of spray. They need to be segregated, social distance. And that's under a business as usual setting. In this pandemic, of course, we're taking even greater precautions, and the patient must wear a mask. And airborne precautions are risk of very fine spray, personal protective equipment, mask for the patient, social distancing, and where possible to separate them out completely from the waiting room or contact with other patients. And for the admin team, if someone rings and says they're coming, they're sick, I think, my child has chickenpox, or I think I've got the flu, it's really important to let the clinical staff know, so let the doctor or let the nurse know that the patient is coming so that they can be triaged and separated as soon as they get there. So hand hygiene, we're hearing a lot about hand hygiene at the moment. And hand hygiene is the singular most effective thing you can do to prevent infection. You touch things, you touch your face, you can become infected. Washing your hands with soap and water is very important. Doesn't need to be a hugely, antiseptic type of hand wash. So liquid soap and water is just fine. And of course, in between, using antimicrobial, using the alcohol rub if you can get it. And still, even after hand washing and even wearing gloves, they can recover significant amounts of your bacteria, but even after gloves, sometimes the patients as well. So everyone should have posters in their practice of how to wash your hands and how to use hand rub. And for accreditation, when they come through, they will be looking at your hand washing facilities and making sure that you've got signs up as evidence that you have actually had some training around that. Making sure, people often forget to wash their thumbs. It's a 20-second hand wash is being recommended. We're seeing that on the television, on a lot of the media reports, but that is recommended as the minimum. And the same with the alcohol rub. Wearing jewellery, traps microorganisms, soap and solutions under the jewellery, under the rings, and can cause skin irritation, which of course then can lead to broken skin and a mode for infection to get in. The 5 moments of hand hygiene. This picture, of course, has got a patient in a bed, but there is a general practice version or an outpatient version of the same poster. You should have that up or something similar in your practices as well, again, to show that you have gone over this with your staff. I highly recommend that everyone in a practice do the hand hygiene course, and it's simple online modules. There's a link there on your screen that will take you to the Hand Hygiene Australia. The courses are aimed at clinical staff as well as administration staff, so that they're tiered to the need of the team in the practice. The really good thing is at the end of it, your team will get, each person who logs on will get a certificate when they complete the course. It's fantastic to display on the wall for your patients to see. They know that you're across the infection control thing. You know, all of your team has done hand wash thing. You can use it as a quality improvement activity for accreditation as well. And it should be built into your staff orientation. So anyone new coming in should do the hand hygiene course. If they haven't done it in the last 12 months, they should show you the certificate, keep a copy in the patient file. And again, as I said, it's a great activity, quality improvement activity for accreditation. Now I'm just going to flick screens here and escape for a second just to pop this little video on. It won't be a sec. Sorry, that it's short and sweet, and I think just gets to the point for the hand washing there, making sure that you have done all the surfaces, making sure that you have done your thumbs as well. Sorry, I'm just trying to get my screen to expand. Yeah, so there's lots of videos around for washing hands, but I think to take that back and to maybe get particularly the non-clinical staff in your team, the university student who is doing the casual work on the front desk, make sure they all know how to properly wash their hands. So I'm often asked about what sort of products to use. And I would say, again, it doesn't need to be a severe product. You're not doing a surgical scrub. You're washing your hands to protect yourself either after a procedure or to protect the patient before you do a procedure. Something that is of reasonable quality, like you get from our medical supply companies. They often have a moisturiser in them, so they're not so harsh on your hands. A lot of the commercial products, particularly the antibacterial ones from the supermarket, are very harsh and they can actually damage your hands, particularly if you're washing them a lot. In relation to alcohol rub, I would say the same thing. A lot of the products that you get in the supermarket, if you can actually get them at the moment, have metho in them, and you can smell the difference between the products that we get from our suppliers, such as Microshield and those similar products. They've got a moisturiser in them, so they're a bit kinder to your hands, as well as it's not a metho-based alcohol product, so it's not quite as harsh. Hand care is really important. Intact skin is your natural defence. So yes, moisturise, moisturise regularly. Best not to use moisturiser that has a Vaseline or petroleum product in it, because particularly if you're putting gloves on shortly afterwards, the petroleum products can actually degrade the rubber, and so while you're wearing them, it can you might not be able to see it, but you can get small defects in gloves anyway, and those type of products will actually degrade it even further. If you're wearing gloves all the time, they do make your hands sweat, so just be mindful that you do need to change them regularly, and to cover cuts and abrasions with a water-resistant dressing, just again to add to that barrier and keep your skin safe. And of course, the Hand Hygiene Australia certificate, as I said, it's great team activity. We did this in the practice I worked in at Hurstville, displayed them all on the board for patients coming in, and they could see that, you know, we got lots of questions about that, and it's comforting for patients to know that you're across that. Okay, so we'll talk a little bit about the PPE and personal protective equipment. So we've got gloves, masks for patients and staff when needed, goggles and face shields, and gowns and aprons. So there's some very creative masks out there, and we've seen lots of people wearing masks in the street at the moment, and whether that's effective or not, I think it makes those people feel safe. You need to make sure that your mask is fitted and that it's the right type of mask for the activity that you are doing. So should you wear a surgical mask? The information here, I've tried to put a link to the information on all of the slides, so that if you need further information or you want to follow up on a particular point that I have up on the slides, you should be able to easily copy and paste that link into your browser. So for most people walking around the street, the answer is no. The World Health Organization clearly on their website says no, and the information coming from the Chief Medical Officer and the Department of Health, the Federal Department of Health, is no. There's no benefit to wearing a surgical mask when you're wandering around the street. It's a benefit for people who are sick, for others, so that they don't cough on them. It catches the spit. It's a benefit for health workers, of course, because we wear masks that hopefully have a waterproof front that are moisture resistant and help to catch any bugs that sick people might cough at us. Health workers are required to wear the appropriate PPE for the activity that they're about to undertake. So for day-to-day activity, we might just need a mask, we might need gloves. But if you're doing something, if you're taking swabs from patients, if you're anything where a coughing patient, where there's a chance of aerosolization of their secretions, then you definitely need to look at wearing a much more higher level protection. With the face masks, have a look at the masks in practice, and you'll see some of them will have a coloured side, and so the coloured side is meant to be moisture resistant, and the back of it is absorbent. So if you cough, it'll catch it and soak it up, but if it's coming at you, hopefully it will help to stop you inhaling. Masks need to be well fitted around the bridge of the nose and come under the chin. And as it reduces exposure from saliva from other people, and as I said, snug fit, the moisture resistant side on the outside. The P2 masks are for high level exposure, and I know that we all had P2 masks delivered to our practices for the use of health professionals. Worldwide, there is a move to just for general activities with patient interaction to just have surgical mask is probably adequate for what most of us are doing. Because of the worldwide shortage of the P2 and the N5 masks, we want them conserved for intensive care units, for ventilated patients, for patients where they have procedures that will generate droplets and, of course, finer particles. Now, if you have a beard, bad news for all of the hipsters out there, the beards don't hold the seal, so the P2 mask isn't going to work effectively. In China, I did this talk, a similar talk in February, and China had made a recommendation that all men be clean shaven, and in fact, a number of the health professionals there also shave their heads, including women. All masks need to be changed if they're soiled or if you've had them on for a long time, you'll get hot, and if you feel that moisture's building up in them, you need to do proper hand hygiene, take your mask off and do hand hygiene again. The P2 masks, their recommendation I saw was roughly 4 hours. The surgical masks are much shorter time. But I think the main issue is you wear the mask as long as you need to, and when you take it off carefully. Applying PPE is important, and the steps that you follow. Hand hygiene, put your gown on first, masks and goggles, and then you put your gloves on last. Putting goggles on, once you have a mask on, it fogs up your glasses, and a lot of health professionals then start rubbing their face, or they'll shift to their glasses with the back of their hand. Try not to do that. My daughter works in dental surgery, and they, as a nurse, and they wear goggles all the time. They have this fantastic product called Fog Off. She said it's a green solution, stops the fog. There are similar products around, and it might be worthwhile having some of that in your practice, particularly if you have to wear goggles. Glasses aren't considered, if you have to wear goggles, glasses aren't considered effective protection. So you do need to put the goggles over the top of your glasses. Taking the PP off is the most important part. You need to perform, take your gloves off. You need to perform hand hygiene. So that can be with alcohol rub. You take your goggles off and dispose of them, or if they're reusable, into a bucket with disinfectant for reprocessing. When you put your gown on and you're tying it you tie it at the back so you don't touch the front of the gown. Anything that's on your front surface has the potential to be contaminated. It's the target for the cough. So you need to, from patients, so you need to make sure you take it off from the back. If you have a buddy to watch you, that is even more helpful because they can tell you, actually, no, don't go there, the other way. When you take your mask off, again, you take that off by the strings and dispose of that into the bin. And of course, perform hand hygiene. And as I said, very important, do not touch the front of your the front of your kit with your bare hands. The Australian Quality and Safety Commission have some very good resources on their website around PPE. And if you just look in the top right-hand corner for the sequence of removing, you can see when I do activities face-to-face with a group, I usually have gloves on the table and get people to practice. Now, the clinicians will know how to do this, but not the clerical staff. They'll probably wear gloves all the time, but are we watching them take them off? It's really important that you have you pinch your glove in the middle of the hand or near the wrist. Don't slide your finger under to touch your skin. And then you pull that glove off as it goes inside out, and then with your bare finger, you can come underneath the cuff of the glove and take it over the top and dispose of it and do hand hygiene. This resource is on the New South Wales Health website, and there's a link there that will take you to the page on their website where they talk about when to wear a mask and when to wear the particular type of PPE. As I said, for most of us, mask and gloves are adequate for most interactions, and of those higher risk times are when you need to look at symptomatic patients, when you need to have a gown or when you need to have some fluid resistant masks, the higher level P2 masks. So what do we do about the rubbish? So we've got patients coming in, we've got lots of masks, we've got our PPE, patients might have touched something. How do we manage that? All practices should have a waste management policy, and all the staff, particularly the staff that put the rubbish out, need to know how to handle waste and how to dispose of it. You need to train your staff, you know, how do they pick up the waste? Do they just go and tip the bin out and plonk it back? Or you need to train them to pick up the plastic bags, to hold them only from the top in case there's sharps in there? What type of waste is it? Is it stuff that's meant to go into the clinical waste, or is it general waste? For most of the most waste coming from practices, the standard waste, dressing packs, speculums, they're actually graded to go in just the regular garbage. But you need to have a look at regulations for your state, and you also need to look at what level of waste disposal that you have. For your accreditation, you need to have a certificate from Waste Destruction Service for your clinical waste. The World Health Organization on the website said there has been no evidence of direct human infection from handling of waste. But I think most of us, we will say that we will put most contaminated waste into the clinical waste. So things like sharps. If we had people, if you're doing flu swabs and gloves, or people coming with measles or other bugs, they're the sort of things that go into the contaminated waste, and it's quite reasonable to put that into the contaminated waste. There is no need. I looked on the World Health website, they said there's no need to do double bagging at this point in time. So, waiting rooms. I think there are a lot of quiet waiting rooms at the moment where people are physically not coming to the doctor, and we're all adapting to that brand new world of maybe not seeing patients unless they really need to be there. Transmission-based precautions need to be used by all staff if they think there's a suspected infectious patient. So whether that be for this particular virus, or whether it be for other illnesses coming in, regular flu, kids that might have chickenpox, they'll come to the practice. Hopefully by the time we get through this, there'll be a behavioural change in patients where they will routinely call ahead to say, well, actually, you know, we're not well. We think we might have something that's infectious. Oh, sorry, I don't know what I've done there. And by now, all our staff should be routinely asking patients, do you have a fever? Do you have any flu-like symptoms? And do we need to actually manage you in a way that's not coming directly into the practice? People will still come, so we just need to make sure that when they do come to the practice, that they're triaged and we respond appropriately to make sure people are isolated. It's really good to offer triage training for your staff, and I know in the past the PHN have triage sessions a couple of times a year. It's really good to make sure you have a script for your staff, so routine questions that they can ask. We tell our team members all the time, protect the patient's privacy. They're told not to be, you know, ask invasive questions. And here we are saying to them, actually, I want to know where you've been on holidays. Do you have a temperature? What's wrong with you? So if you give it a standard set of questions to the team that they can work through, it helps take the onus of them for that interaction where they feel they might be invading patients' privacy, but also gives us consistent information back about signs and symptoms of what the patient might have, whether it be measles, which there is a current outbreak in Sydney, gastro or flu coronavirus. And this should be built into your pandemic response plan. Respiratory etiquette, of course, people need to maintain that social distance of at least 1.5 metres. So you'll have a lot of patients coming in for flu vaccines and hopefully pneumonia vaccines. You'll still have babies coming for vaccines, some routine things that need physical examination. So social distancing, covering the face if they need to, cough to their elbow. We should have signs up for patients to do that. And of course, to have an infection control station where you have masks and vomit bags if you need them, and alcohol rub. And getting patients to do hand hygiene, coming in and leaving the practice. So a little bit about the pandemic flu kit, and it's as I said, it's an easy to access for you as from the College of GP websites. It talks to you about the modes of transmission and about all of those things we've talked about tonight, about appointing someone in the practice to be the pandemic leader, appointing someone in the practice. You may need, because there's so much communication coming through, someone in the practice to lead communication so that they can keep all of the team updated. We get a lot of stuff in, the doctors read it, the nurses read it, comes to the practice manager, does it filter out to everyone? So you need to make sure you have not just a weekly staff meeting at this point. You may need to update the team daily. We've heard huddles in relation to healthcare home and patient-centred homes. So maybe you actually need an infection control huddle daily. And as patient numbers rise, probably that will become even more important. Nurse-led immunisation clinic for your flu patients coming in, so you can get them in and out very quickly. The flu kit's available on the College of GP website, and there's also an exercise module that you can work through with exercises in it for your practice team. So I did an infection control presentation in February. So this is 8 weeks ago. And the picture then was mostly China. We've got 40,000 or 40,500 people sick and 910 deaths. This is from the Johns Hopkins website. You've probably seen it on the TV. It's often quoted on the news. And of course, here we are at, nearly 900,000 cases. This is from the 1st of April, and 42,500 deaths. The news tonight, I'm sure they said there was 500 deaths in the UK overnight. So how is a pandemic different from seasonal flu? So a pandemic is something that rarely happens. We have little or no immunity to it because it's brand new. It can be from a mutated virus from a person who it's mutated, and then that spreads, and they can actually track the DNA for where it comes from. And sometimes if an animal is infected and it can then pass that on to a human, and the human in some situations then mutates inside the human, and then it comes out, the new virus comes out as actually being highly infectious to humans. Again, the symptoms are more severe because we have no immunity. It's highly transmissible. Again, we don't have any immunity. There's often serious complications, and partly we don't have immunity, but also there's no treatments early. Drug therapies at the moment are unproven, and there was a rush on, is it chloroquine? There was one Dutch paper that quoted a particular medication, and then as maybe having some protection, and it was a very small trial. It was something like only 20 or 30 people, and the control group, they fared better. That they had a couple of types of medication, and the control group not so well. A couple of people died, a couple of people dropped out. So it's a very small study that then caused a worldwide rush on this particular medication. And of course, now pharmacists aren't supplying it. The patients that actually needed it couldn't get it. So we need to be very careful about what we say about treatments in these early stages. And we're seeing, of course, a major impact on on the entire way we live at the moment. The best prevention for vaccine is, of course, for infection like this is, of course, vaccine, and they're saying still 12 to 18 months away. During the swine flu epidemic, there were large numbers of deaths in the Northern Hemisphere. And when we got our flu season, we actually did better at quarantining. It was still significant. We had 5 times the use of annual use of ECMO around the country. There are a number of deaths. People with chronic diseases died. Pregnant women were died. A lot of pregnant women that lost babies because of being infected with the swine flu. But Australia, the vaccine was here for the second wave. Often you'll see these pandemics will come back. So the first wave will get a large number of people, and but the ones that it didn't get the first time, it comes back to get them. Australia did very well to stop the second wave because we had such an effective mass immunisation program against the swine flu. And you can see here, these are just a quick snapshot of the cumulative cases. These, of course, have gone up overnight, and this was to the end of March. So you can see here the blue lines have dropped, which means the number of new infections at that point had dropped off. And you know, hopefully it's too hard to say conclusively at this early stage, but the social distancing is helping. So, are you ready for this, to manage this pandemic? Now, the close contact definition, and that will put you at higher risk, is greater than 15 minutes in face-to-face contact with a confirmed case, and usually a confirmed case that's coughing, or you've been in a shared space with someone who has the illness for more than 2 hours. So if your doctor's having a bad day and you're in a waiting room for 2 hours with someone that's sick, there's a chance that you can catch it. The Australian government and all of the state governments have an amazing amount of information out about the coronavirus, about how to do things like manage a waiting room and hand hygiene and the illness. There's news alerts coming through, so through the governments. Your PHN, of course, has a dedicated page to coronavirus, and the peak bodies are sending out information to GPs and to nurses and to practice managers. So there's a lot of information out there. So symptoms, they're very similar. In the early stages, the incubation for flu is 1 to 3 days, and we know flu-like symptoms. It can progress for some people. They will get a secondary, bacterial infection. They can get pneumonia, so it can lay them out for a while. And the incubation period ranges between 1 to 2 days for the coronavirus, but the median is about 5 to 6 days. And again, flu-like symptoms early on, but can progress very quickly, where the shortness of breath, they get a thing called adult respiratory distress syndrome, which basically their lungs feel stiff. They can't take in oxygen, which is why so many get on the ventilator, and then, of course, can progress to multiple organ failure. So staff meeting, plan is the big thing. Make sure everyone knows what the action plan is. Have that script. Make sure you've got your waiting room managed really well. Cleaning and decontamination of surfaces. And whoever is doing the cleaning, if you have had a patient that you suspect has the coronavirus, you need to clean all the surfaces. That person, at the very minimum, needs to have a mask and gloves, and that room has to sit aside for 30 minutes after that patient goes. Just before I went on holidays to New Zealand, we had a patient come into our practice And we had the coronavirus signs up everywhere. Please let us know if you've been overseas. He gets halfway through consultation with our registrar and laughs and says, oh yeah, I just needed my scripts, but the kids reckon I should be tested for coronavirus. And he said, why? He said, oh, I've got a bit of a temperature and I've just come back from Japan. And so still, even with everything you get out there, patients will come in and you'll get a surprise. What do I do at reception? Screen all of the patients. Some of the online booking systems now have the screening questionnaire when the patient wants to book, and then if they tick that they've got fever or symptoms, they're referred to call the practice. If you're sick, so anyone who has a runny nose, plain mask, single room with a carer if possible, even better to wait outside. Some practices have got chairs outside for patients and of course sort of at adequate distance, or if you have a car park where the patient can wait in their car, that's even better. Have their mobile number ready so that the GP can ring if they're going out to the car, one so the patient is ready, but two that so that the GP is aware that they're actually in the car park, because we're concerned that they're infectious. And again, social distancing, and make sure that you're wiping down the surfaces in the practice regularly during the day, just with just plain detergent, and detergent wipes is fine. Tips, we said we went to symptom checking before they all arrive. You'll still get walk-ins, and I think you just need to, the clerical team need to police everyone. No one gets through the door without hand hygiene. Most practices now, no one gets through the door without a questionnaire. Enforce cough etiquette with adults and children, and waiting outside. Make sure all your staff have their vaccinations up to date, and make sure when patients you're checking that they've had all of their particular vaccinations. I was watching a webinar on the World Health site this week, and Dr. Tedros said that you can expect a rise in other vaccine preventable diseases during an epidemic, and of course a pandemic even more. So to make sure that people, they've had their flu shot, they've had their pneumonia shots, adults who get run down, higher risk of herpes zoster if they've had chickenpox as a child. So making sure that we can do the best we can. And for staff members, if they're sick, stay at home. There was a practice in the UK, I'm sure there's been many now, where infected staff member came to work. They had to close the practice for 2 weeks. So it's really important that the staff know if you're sick, you need to stay at home. It's not the sort of thing we want you to soldier on. Important things, keep your hands away from your face. And as I said, the minute you put your gloves on, that's when you get the itchy nose, or I just need to straighten my hair with the back of my hand. Keep your hands away from the face. Hand hygiene regularly, and to practice with your team putting gloves on and off, and getting them to watch each other to make sure they're doing it properly. No food at reception. Food, face, and just get rid of it. And any shared water dispensers in the practice, the same. People fill up their water bottles, they've had it to their mouth, they often touch the spout on the water dispenser, get rid of it. Cash, a lot of places have moved to just tap for everything, so the staff don't have to actually handle the cash. Cash is journey at the best of times. And stop wearing jewellery, hand jewellery, because it makes as I said before, you can get water and bugs and soap caught under the hands, under those jewellery that you don't realise is there. Consider a separate session for over 65s. So we're coming into flu season. How are we going to manage this? Some practices will have an easy entry-exit point for older people, Some practices have the space to set up an outdoor tent to manage people coming in and out, but a lot of them don't. So it might be worth considering just having a flu session where you get as many of the over 65s in, with as many team members as possible doing those vaccines, so you can get through them and get them in and out, and anyone with an acute illness to book them into appointments in the afternoon. And of course, just for the staff are under a lot of pressure at the moment. They're taking calls from people who want to come and see the doctor. They're not used to being told they can't come and see the doctor, so they're upset. Sometimes they get angry. But increasingly at the moment, staff are getting more and more calls from people who are distressed they've lost their jobs. And to have the pandemic and the fact that people are stressed because they're actually now unemployed is very stressful, particularly if you haven't been trained to deal with people in crisis. So I think it's really important that you debrief the staff. The staff will be scared. They don't know about this horrible illness that they can see terrible things happening around the world. If they're casual, there's of course the temptation to come to work when they're sick, because often they won't get paid. So there's a lot of complex things happening that can create stress on your team that will just need to be, I think, managed so that they're not anxious and they're aware that you know they're doing the best they can under a difficult time. As I said, making sure all of your team is vaccinated and up to date. And in the immunisation handbook, there's a list of all of the things you need for healthcare workers, and just making sure they've got that. And of course, again, as I said, you'll need that for accreditation. Environmental management is also important. So the coronavirus is, they call it an enveloped virus. It's got a fatty coating and it can be broken down with detergent. So soap and water can be very effective. Limit aerosol spray. So Glen 20, and I know that the PHN team will laugh, I hate Glen 20. It's next to useless. It can be an airway irritant for some people. It's not what you need in a healthcare situation for any sort of cleaning protection. Getting lots of questions about products. So we need to look at, you need to check the products that you use will destroy viruses. So I had a bit of a look on the ViroClean website. I don't want to particularly mention products, but the couple that I looked at, it was a bit, nobody really wanted to commit to this virus, though a lot of their products say they kill other viruses. So I think you need to look at the product info. It should tell you what you need to know in an easy to find place, whether it's on the label or on their website. Whatever product you use, you need to have the data safety sheets, so that if your team finds it irritant, or if they have a splash in their face, that you have the product information about what to do if that happens. And to make sure that you have sufficient time with the wet surface, if you're doing bench tops and desks. For instance, bleach needs at least 10 minutes wet time before it will kill a virus. You need to have enough wet time on that surface. Alcohol wipes dry very quickly and potentially will not kill the virus. So you need to look at a product that helps. The New South Wales health website has a dilution if you want to use bleach. The PHN also, when we look at the Health Pathways website, there is a tab in there, a link for advice around cleaning practice. You just need to also be mindful that things like bleach will deteriorate your surfaces in your practice with repeated use. So the CDC recommendations are cleaning schedules for every patient area, contingency plans required with cleaning procedures, you know, how to do it, who performs it, how often it needs to be performed, monitoring that staff are actually doing it properly, and looking for having a list of approved products, and PPE and hand hygiene. So we've done a bit of this on the ready-made disinfectant products. The TGA has a list of criteria that particular products have to meet before they can claim they do things. The bleach solution degrades very quickly if you're using bleach in sunlight and time, so it needs to be fresh every time. And sometimes there's a feeling that, oh, well, if I mix this product and that product, that'll work twice as good. No, it doesn't. You need to make sure what you have the potential to do is then to have products that are very airway irritant, or that might destroy the surfaces that you are using. And a lot of these stronger products, they are airway irritants, so you need to really think about, do I need something really strong, or do I need something that's just going to basically kill the bug? The Department of Health, and I think this link is also in the cleaning schedule that's on the PHN on the local health pathways about routine cleaning, and you can see there on the left-hand side, detergent or detergent wipes are probably enough for most of what we need in working in a medical practice. Follow the dilution instructions on the product label. If you make it too strong, it can be irritant, and you need to make sure your areas are well ventilated. Frequently asked questions about travellers. I am quite across this because, having had 3 weeks in New Zealand and coming home just after the 14 days isolation or quarantine came in, my children were convinced they had to move out of the house. The neighbours, who are also health professionals, were convinced the children had to move out of the house and had offered to take them, which I really should have taken them up on that offer. But if you're asymptomatic, then your household contacts don't have to be in isolation at this point in time. If you or if anyone in your house develops symptoms, then everyone in your house stays home. But at this point, for return travellers, there's probably not that many travellers returning now, but they can still come and go. They can go to work as well. And there's information on those links about return travellers. The Health Pathways is a fantastic website. I know some of the team that have been doing updating on the website. They're doing it very regularly. Clinical pathways, information about different activities for making your practice ready. And as I said, they're updating it. The PHN are updating their website almost every day as the information changes, as the picture changes. And for anyone who hasn't been on Health Pathways, it's very easy to register. You can either link to either the Sydney Health Pathway or the South East Sydney Health Pathways through the PHN website, or to go directly to those addresses above. There's fantastic updates for GPs on the COVID-19 for GPs website. Michael Kidd, Dr. Michael Kidd, who is the Chief Medical Advisor for the response for primary care in particular, has weekly webinars. He had one today, and you can find them on Google search. I particularly enjoyed the ones he had last week. He updates you on the disease situation. He has advisors from the Department of Health with him, and then also all of the changes, the telehealth changes, the response changes in a webinar. You can subscribe. There's a newsletter for GPs that you can subscribe to, and they do a dump twice a week. And of course, there is the COVID-19. The government has put together a training module. And when I came back from New Zealand a couple of weeks ago, I tried to register, but couldn't get on. And Dr. Kidd said in the last week that the website was so popular that they've had to stop new registrations. There were people from a lot of overseas health professionals logging in to do our training. The World Health Organization has COVID-19 training modules on there. Very simple webinar. The basic one, there's 3 modules that takes an hour and a half for information about management. And again, that's free and easy to get into. And of course, there's a national helpline that people can ring if they're worried, and the links for that are there. That's operating 24 hours a day at the moment. And that's it. So I will escape from the PowerPoint here and throw back to Fleur, who will take some questions.
Great. Thank you, Karen, for your presentation. And I just want to remind everybody that the online evaluation has been sent through. If you can please complete that, and you'll receive a certificate. Practice nurses can self-report for CPD points if they like. And we'll go through the questions that we have. We'll try and stick to the ones that relate to infection control. So first of all, from Lai, we have, how do we decontaminate the computer, keyboard and laptop? I know, Karen, you didn't mention it through your presentation.
Very easy, just the same things you would use on a bench top. Try not to spray. If you do have a pump pack spray, spray it into a disposable paper towel. And I did forget to mention, whilst there are, you can get chucks or similar products. It's called chucks for a reason. You chuck it out. You don't save it to use the next day or the next day. So whatever you wipe it with, and then you dispose of that. But whatever products you're using at the moment is sufficient. And make sure you do the phones.
And door handles, my favourite. Okay, and now from Margot. She says, I'm sure you will cover this. However, the biggest issue of confusion over when to wear a mask and which mask to wear. I'm sure many masks are worn at the wrong time. You are so right, Margot. And Karen?
Yeah. So the link in the discussion in the slides on masks, there's a link there to the latest Department of Health, Federal Department of Health information, and we really are trying to conserve the P2 masks for those high risk areas, and that and Dr. Murphy, Brenda Murphy, the Chief Medical Officer, said also that a properly fitted just surgical mask is enough for most interactions. So really only save your P2 masks for if you have someone who's coughing and spluttering and you think you need the extra protection. And of course, with the shortages, that makes that even more crucial to conserve those masks.
Yes. Another couple from Lai, how to access hand sanitizers. There's a link on our coronavirus page on the website. And will diluted bleach ruin computers and GP tools? Yes, it will damage your computers. It will take the letters off your keyboard. Anything on GP tools, Karen?
I'm not quite sure what you mean by GP tools.
She's put using diluted bleach on GP tools. I would assume things that you wouldn't be sterilising.
Yeah, so the equipment, your stethoscope, the iriscope, all of those things. A quick wipe with bleach that's to the correct dilutions. Now, that is on the link from the PHN website, is probably takes you to cleaning products. I don't think you need to be that severe. It will damage surfaces, so it might be okay a couple of times, but if you're using it all the time and you've got a 10-minute wait time, then I think, yeah, the potential to damage equipment is very high.
Okay. Another one here that isn't, I don't know if it was infection control. Should all employees that have immune deficiency issues be made redundant and rehired? It's been clearly stated that anybody with an immune deficiency in practice, GP, should be working from home. Making someone redundant, you'll have to be following Fair Work Australia's guidelines, and we do have a link on our website page. The next question is, once a person has coughed, how long does it take for the room to be clear of it?
So the recommendation is that you would clean the surfaces, and then it needs to sit for half an hour. The actual virus itself can remain on the surfaces for hours to days, but that's usually in a high volume setting, and we're not seeing that now. And if we do routine cleaning, then that will be enough.
Tane, question, when should clinical and non-clinical staff wear masks? I think Karen did address that with instructions on the type of job or task you were doing. Any other reasons why admin staff would be wearing a mask, Karen?
Look, at this point, they're saying most interactions are social distancing is what you really need. And for droplet infection, which is the most common medium that they're talking about, a metre and a half. And of course, all of those things like not handling cash from patients, getting them to tap so that you're not touching things that they've touched. You might, I read one document where they talked about a new pen for every patient that has to fill in the form that, I don't know, since the drug companies don't give it to us anymore, it might be a bit hard to get a pen, cynical me. But, you know, if you need to, wipe them over.
Wipe them. Another question from Andrea. How extensive does the cleaning need to be in a physiotherapy treatment room between patients? We are not using any sheets or towels. I would be assuming that they would be using disposable paper sheets. But any ideas on cleaning physiotherapy rooms, Karen?
Look, I think we need to go a step before that and do a risk assessment. So if you're a health professional seeing patients, you need to ask them, are you well? Is anyone in your house sick? And I think they're really important things. You could go as far as taking their temperature when they arrive, but I think asking those questions are really important before they actually get onto the bed. And, you know, you might have to delay their treatment. If you're not using any sheets, you could just give it a quick wipe in between with a mild detergent.
So any modality, physiotherapy, would be triaging the same as in GP practice before any patient comes in the door. There's triage questions on our website again. Another question.
Can I just, sorry,
Sure.
Flo, I'll just add, there was a question about that on the webinar with Dr. Kidd, I think, yesterday. And the question came up about physiotherapy practices and gyms in physios. A lot of them have gyms. The advice there was it needs to be social distance, and other gyms have had to close. So it would be really those hands-on treatment that needed to be done, I think is what is being recommended at the moment.
Another question from Andrea. Is it better for a patient to wash their hands on arrival at the practice rather than, and I can't see the rest of the question.
Yeah, absolutely. Hand hygiene as they come in the door and hand hygiene going out. So does it need to be washed if they're dirty? Otherwise, alcohol rub.
Yeah, I think that's great if everybody washes their hands on arrival. Another question from Narelle. Just an update for you. Hand Hygiene Australia is now managed Safety and Quality Commission and is called NHHI, National Hand Hygiene Initiative. Okay, it's still going through the same link that we have and that Karen was referring to. Yes.
Oh, okay, good. Yeah, I knew the modules were being migrated. They were working on them early.
Quick question from Peter Ryan. Why is the UK using 7-day isolation and here it's 14? So it's not really, that's linked to COVID and it's not really a decision made at the infection control general practice level.
Yeah, I would say we have regulations that we have to follow. And of course, with a lot of the changes are slightly different state to state, but 14 days nationally is mandatory. And that's what we have to do. If the incubation period, the median is 5 to 6 days, and you're going out at day 7 and you're still cooking it, you're still shedding the virus, it's better to wait. Yeah. I've been captive for 2 weeks, so I can tell you, not bad.
Question here from Michael Wright. Hi, Karen. Are there any supports for practice nurses to debrief outside of a practice, for example, through APNA or other groups?
Thank you, Michael. Very good question. For APNA, we've got an APNA Facebook page that a lot of nurses we put information through. But we do have quite a large member-only discussion page. And if you're a member of APNA, you can apply to join that. There's been some really good information on there. And as Michael said, it's a really good way to debrief. A lot of PHN areas, all of areas will have nurse networks, and of course, because we can't meet at the moment, the Sydney, the PHN have a lot of nurse education meetings, so they're really good forums to come in. It's really nice to offload sometimes face to face, like have a cup of tea and talk about it. But the APNA forum on the members on the member Facebook pages is really I'd say going off at the moment. Lots of people wanting to know stuff and share.
And I would imagine that as time goes on, more groups will pop up using different platforms to support each other. Another question here, Alison. Isn't soap enough to kill the virus then as it breaks the coating?
Yes, for surfaces and hand washing. I think that's probably it's recommended that simple detergents are good for breaking the coating. It's simple to kill, but what happens is that when you're infected and it's in you, that's a much harder thing.
Okay, RP's got a story here that will make you cringe. She has heard from another practice that staff were told to recycle masks by spraying Glen 20 to the mask, then place it inside a specimen bag and reuse again until the following week. Is this safe? Well, I'm sure after listening to your presentation, we're all cringing at that.
Look, I'd say because of the PPE shortage, people are trying to be quite creative. And I read through the College of Infection Prevention Control, I'm in a sort of professional chat room, and they're sending papers through all the time. And there was I can't remember if it was Belgian or Dutch group who had looked at their P2 masks, and they had they had sterilised them. They'd gone through steam sterilising and gas sterilising, and they had said they thought the filtration was okay for 1 or 2 goes. But having said that, the information on the World Health website says it can damage the filters and do not do it. And all of the manufacturers will say to you, do not do it. It's not safe. And certainly the surgical masks, that's not on. They go in the bin.
No.
They're one person, one use, disposable.
The risk is just not worth it.
It's too high.
Yeah. Question here from Suzanne. How to decontaminate, clean your blood pressure cuff?
Give it a good soapy wash.
Yeah.
Hang it on the line in the sunlight if you can.
Lots of practices, question from Belinda, lots of practices only have a cleaner once or twice a week. Should the floor be cleaned more often?
That's a very good question. And most practices would probably have a professional cleaner, a small to medium-sized practice, a couple of times a week. The main thing is that it's not, if you drop something on the floor, whether it was cleaned yesterday or 2 days ago, that's it, it's contaminated, it's gone. You need to either, if it's an instrument, clean it, or if it's, dressing material, it's in the bin. So as long as I think the floor is physically clean and, that's reasonable. In between, cleaners come in, cleaners will do bench tops and do the sinks for you, but you need to top that up. It needs to be done. Certainly at the moment they're recommending at least twice a day to do your benches, your surfaces where patients are coming in and out, but it certainly needs to be done at the end of every day.
So Belinda, Karen had earlier mentioned in the presentation about having a cleaning schedule, cleaning checklist. It's sometimes a good idea to do an audit to have a list of everything that needs to be cleaned and then work out who's doing it. Often people find there's a gap where somebody thought somebody else was doing it. A question from Peggy. Any evidence for the spread of infection for people who work in agile environments versus the traditional office setup, i.e. working from office rooms and partitions? Working with office rooms and partitions, sorry.
I think I'm not aware of a particular study looking like that. It's back to close contact with people, touching surfaces that someone infected has touched, and when you touch your face, you pick it up. I think if we look at that, that's the most important, I think. And, if you have a fellow worker who's sick, they should be home. Oh, Flip?
There, Flo.
I think Fleur's frozen.
She looks like she's frozen.
I might just jump in then and because I've got access to some of the questions.
Yep.
Karen, apart from alcohol, what other products can work on coronavirus?
I think, so we've talked about bleach, but not recommended for long-term or frequent use. I think you need to look at the sort of products we have. We're told that things that most practices have, like Clean Dirt and ViraClean, are reasonable, but I think you need to do your own risk management and check the products that you use are suitable for the purpose.
Okay, great. Another question is, can
I'm
UV
back. My
sterilizer?
internet dropped out there. How much?
Sorry, can UV sterilizer be used to reuse surgical masks?
No, I think we covered that, and it's absolutely not on. That goes back to the clinical governance issue and who the responsibility of the practice owner to make sure that there are safe practices in the general practice, and to reuse and re-sterilise those masks is not a safe practice.
You back online, Fleur?
I am. My internet froze. I think all the kids jumped online after dinner. Very handy. Which question are we up to, Bertha?
Just sending them through to you, but let me jump in. Karen, is eucalyptus oil and tea tree oil good for wiping down benches?
We use tea tree oil for a lot of things, and but I don't know if you can put up with the smell, and you need to look at wherever you're getting it from, what the product information says. And you know, we use it, podiatrists use it, I know, to treat fungal infections in nails. But for our purpose, we need to make sure the products that we use, we have the information. And that's some of the essential oils, like tea tree oil, can be an airway irritant. So you need to make sure that can be a safety issue for your staff.
Okay. One here from Cynthia. How about air conditioning symptoms? I know that most practices have a routine air conditioning maintenance system set up. Would that be correct, Karen?
Hopefully. But if you're in a big office and you're not in control of managing the air conditioning maintenance, actually that's not my area of expertise. And hopefully you'll have they'll have reasonable cleaning and reasonable filtration if you're in a big centre, and in the small centres, you know, that's just air conditioning maintenance. Opening the window if you've got a window is really helpful.
Okay. Do we have any more questions? I think that's about it. So we're looking at 8:43. So again, thank you everyone for coming online. Thank you very much, Karen. Really appreciate you getting everything up to date with things changing so much. Again, everyone, can you complete your online evaluation forms? If you have any more questions, on our coronavirus page, we have email addresses for
Yep, Flo's gone. I'll take it over. Yes, on our coronavirus page, we've got email addresses for coronavirus and other dedicated type of questions, telehealth. So please link into those if you need any questions.
feel free to get anybody else you know, send them in the direction to watch the webinar. Anything else you'd like to say, Karen?
Look, I just wanted to say that the PHN is a wealth of knowledge, and the Health Pathways website is sensational, and it lets you know what's happening local to you, as does the PHN website. So they're probably really good things to monitor regularly. All of the other we'll hear about over the news any major changes or announcements. But source of knowledge, I think PHN is a really good starting place. It's accessible and you know it, so that's really good.
And Jan, what would
Yep.
you like to
I'll
close
just
off
fill
with?
in because I think your internet dropped out again a little bit there, Fleur, so I'll just go over a couple of things. So once you've completed your evaluation, you'll receive a certificate of attendance. Please have a look at the assessment website for other upcoming webinars, and a live recording of this webinar will be available in our video library shortly, and it'll be on our coronavirus page also. So I guess that's probably it for tonight. Is that all good for you, Karen?
It's great for me. Hopefully it's all right for everyone else.
Yeah, yep. I'm
Thank you,
sure it
everyone.
was. Yeah, thank you.
Thank
Thanks,
you.
everybody. Stay
Good
safe
night.
out there. Don't forget to physical distance and social distance, and have a good night. And don't forget, if you need any support or anything, please contact us at the Central and Eastern Sydney PHN. Have a great night. Thank you.
Thank you.